And it was Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about what I call the COCR or CRCO shift triad. And I kind of made this turn up, so you might not find it anywhere else. But basically, it's really common in mixed dentition patients to see COCR shifts. I'm really good at noticing them. I can see them across the room at a restaurant. I can see them down the hallway. I can see them in a chair. I can see them everywhere. I can see them from photos. My eyes are trained to see them, and most orthodontists are too. But you guys are still training, so whether you're a general dentist or a pediatric dentist, it's going to take time for you to see it. The problem is, and I mean, maybe it wasn't as much of a problem way back when we were only doing braces, because we would unravel the bite and straighten the teeth and it would go away, assuming we coordinated the arches. So it wasn't a big deal. The problem is now that so many of you guys are doing mixed dentition aligner cases, or this can happen even in permanent dentition, you can have it. It's a little more rare. And you guys are going, oh, well, look at this. We've got midlines off. We've got to add IPR. And we've got a class 2 on the left, but a class 1 on the right. So we've got to add an elastic. And you guys are taking it at face value instead of realizing it's a shift and treatment planning accordingly, and then you're getting really bad permanent outcomes because you're not realizing, shoot, this is a shift. Let me take a step back and unravel the shift before, and most likely the midline issue and the asymmetry is going to go away, instead of doing something permanent where we actually create a permanent deviation, which is what's going to happen, if that makes sense. And I don't want to freak you out, but I just want to kind of hammer in your head. Anytime you see any of these three things, and I want you to screen every single kiddo patient. I don't care if they're 4, 6, 8, 12, even teenagers, even adults is a good idea. By the time they're an adult, it's ingrained. There's not much you can do. It's really hard to undo a shift. There's muscle memory. It's possible that they may have asymmetry in the growth because they were already shifting for all these years while they were growing. If you're shifting to one side constantly, every day, every night, that side's gonna grow a little bit more. And now it's permanent. So that's why we want to unravel this even more so in aligner cases, because like I said, braces cases don't freak me out. Or when you see any of these three things, don't make a full treatment plan. Sometimes I work with doctors on their cases and they're like, well, we need to address the midline. I'm like, I don't think there's really a midline issue. Let's just reevaluate that. Put that down as reevaluate. And that's totally okay when you make a treatment plan to put, I see these issues. It might be due to a shift. We will address these later in 6 months, 12 months, whether it be class 2 on one side, class 3 on one side, midline shifts, facial asymmetry. And then you have to remind yourself, though, to go back and reevaluate to see if it's still present, because you will forget. So let's go through these 3 triads. First one is facial asymmetry at rest. Sure, we can be asymmetric. We might have grown wrong, but most of the time I put my money on that this is a shift. If you see like little jaw off to one side or the other, it's usually the lower. If it's upper asymmetry, well, then that's probably a growth issue. Down here, we have unilateral class 2 or class 3 malocclusion or unilateral crossbite. Anytime, I've got another video it's titled something like a unilateral crossbite in a kid is a unicorn. I don't think I've ever seen one. They're always bilateral with a shift. So, I've never seen one. They would have to have like a massive trauma or asymmetry. It'd just be so rare. I don't think I've seen one in 22 years. So anytime you see a unilateral crossbite in a kid is a shift. Same thing with unilateral class 2 or class 3 malocclusion. Sure, it can happen if somebody pulled a tooth early or tooth fell out early and something shifted forward. But that's not skeletal, that's dental. So keep your eye out for this, okay? And then the last one is lower midline off. Upper midline's on with the nose and the eyes, lower is off. So usually you'll see all 3 of these in a COCR shift. And take a look, I have a lot of other content about COCR shifts. I'd love for you to check them out, as well as we have our phase 1 course, which is available. But everything that's in the phase 1 course is very affordable. I try to keep it as low as possible, and they obviously charge us money to put it on, to administrate it, to give the CE credits and stuff like that. But I basically kept the price as low as possible. It's just covering the admin, the video, the CE, everything like that. It's the same content that's in my YouTube channel. Matter of fact, there's even more in the YouTube channel. It's just I literally take out what's absolutely necessary. I mean, there's probably 300 hours in the YouTube channel. I'm just guessing. This is 14 hours. You know what I mean? So it's the really most important things, and it's in like an actual logical order. YouTube is never in a logical order when you go in a playlist. So it'll kind of take you through diagnosis, treatment planning, expanders, growth modification for vertical, growth modification for AP, sagittal, things like that. Braces, aligners. All right, thanks so much.